Hi, I'm Robert Parisien. I'm an orthopedic sports medicine surgeon at Mount Sinai Health System. Well, leading up to the marathon, runners should obviously be training appropriately and then sort of trying to recreate the marathon day environment as best as possible. So you want to be running at the race pace that you're going to be typically running at on race day. You want to be monitoring that pace, and you want to have a pacing plan for race day so that you don't get out and start a bit too fast on race day. You also want to have the same nutrition plan, and you want to be training your gut and training with the same nutrition regimen that you're planning on having on race day as well. Leading up to race day, as we are now, you should be tapering. So you really need to be lowering that volume of mileage that you're doing and allowing your muscles and your tendons to really recover. Many runners often have some tendinopathies or some just aches and sores or tendinitis, which is inflammation of tendons and muscles as they lead up to race day. So it's really important to taper that mileage and lower that volume as you lead into race day so your muscles and tendons are really ready for the race day. So as you're preparing for the race and you're training, if you do have some muscle aches and some tendon aches, you do not want to run through those because they may worsen. Those can be very symptomatic and problematic, and leading up to race day, you may get yourself into a state, if you don't have an appropriate taper and an appropriate rest period prior to race, you may find yourself in a position where you're unable to compete in the race, or you're unable to finish the race secondary to some of these chronic tendinopathies or tendinitis issues and inflammation issues that you might be experiencing. Also important to cross-train as well, and that can really help to alleviate the risk of having specific chronic issues that are popping up prior to your race day. With cross-training, you're training the different muscle groups and different tendons, and so you'll have less of a chance to have some of those chronic overuse injuries. So common things leading up to race day and during race day is, again, a lot of chronic overuse conditions. That's IT band syndrome or IT band tendinitis. So IT band is a long piece of tissue that runs down along the side of the leg and it crosses the knee. And that can be very symptomatic and problematic for runners. You can also have pain and issues with relates to the patella tendon. Again, same thing, patella tendinopathy, tendinitis. You can have pain underneath the kneecap, for example. So if you don't have appropriate strength in we call them the dynamic hip stabilizers, so all the major muscles that help stabilize the hip, your lumbar musculature, your core, as well as your hamstrings and quads, you can have some added micro motion of your kneecap, we call it the patella, when you're running, and that can lead to some patellofemoral or some kneecap type symptoms. And again, that can be helped with strengthening, but that really has to be addressed prior to race day as you're training and preparing for race day. Achilles tendinopathy, tendinitis, pain around the Achilles tendon is common with runners. And so, these are all some of the common running, types of aches and pains and issues. Now, these things can be addressed prior to race day so you don't experience them as you're competing in the race. As you're recovering from the race, immediately after the race, you want to be warming yourself, you want to be refueling, you want to keep walking, you want to keep moving. You don't want to let your blood pressure drop too drastically. You really want to let your heart rate kind of gradually slow down to its baseline. And then over the ensuing days and weeks when you're recovering, you just want to make sure that you have appropriate nutrition. You're not going back out and, let's say running another half marathon the next day. But, you do want to be active. You do want to be walking around. You want to try to get rid of some of those muscle aches and soreness. And then hydrating is going to be very important, both before the race, during the race, and after the race as you're recovering. But I would remind runners that when you're running and you're participating in the race, drink as per your thirst. You don't really want to over drink and you don't want to under drink, because that can lead to different electrolyte abnormalities as well as muscle fatigue and weakness, even some confusion in some extreme cases. So on race day, the weather can be unpredictable. And so last year at the New York City Marathon, I was providing medical coverage at the finish line. It was a warm day in New York City, and so you had a lot of heat-related issues. Now, what is that? That can be heat exhaustion, or that can be even heat stroke if it's severe enough. That's when your core body temperature is really elevated. So, what do you want to be doing prior to race day? You want to be hydrating enough so that you're prepared, and you want to be looking after your nutrition throughout the race. While you're racing, you do want to be taking in some some water and electrolytes as well to help you against that. Now, if you really are experiencing a scenario where you have some heat exhaustion or some heat stroke, there are medical professionals that are going to be there all throughout the course during the New York City Marathon. And we may even need to utilize some icing, some dunk tanks to really try to lower that core body temperature, which can, again, if it gets too elevated, can be dangerous. Many times you can have some cool environments in the morning of the race, and so people have a tendency to overdress. And then as the race goes on, the temperature rises, maybe 10, 15, 20 degrees. Your core body temperature also rises. So you want to be careful not to necessarily overdress for race day if it's a cool morning. Now, if it is a little bit colder in the morning, of course, you don't want to be waiting there for half hour, 45 minutes without having a shirt on, anything that is really warming, but at least wear some expendable materials. So maybe you're wearing a long sleeve shirt that you can take off during the race as the temperature increases and as your core body temperature increases. And it is not something that you necessarily have to wrap around your waist and run with, something that you can easily expend during the race, so that again you're making sure that your core temperature doesn't get too warm throughout the race, especially if it's cool in the morning and things warm up and you warm up as you're running. During the race, and for many of you that have been runners and have been training, you've come across muscle spasms, muscle cramps, and all of these aches and pains that we've been discussing. To help prevent against these muscle cramps is a few things. You want to, of course, as I said, hydrate prior to the race and leading up to the race. You also want to be tapering as you lead into it and decreasing your volume, allowing your muscles and tendons to recover and be ready for race day. During race day, you can drink per your thirst, so really not over or under drink. But if you happen to have cramps, and sometimes it's really unavoidable in many scenarios, you want to slow down. Maybe it's a light jog. Maybe you have to slow down to a walk. You might have to stop. You might have to stretch during that period. You can certainly try to hydrate as well. And then you can gradually try to increase your activity during that race, whether you start walking faster, start a light jog, and then see if you're able to continue running. But you may have to rest and stretch and slow your pace a bit to try to manage some of these symptoms throughout the race, especially with cramping. Get a good night's sleep before the race. Make sure that you don't start out too fast, that you are aware of your pace, that you maintain the same nutrition habits that you were doing while you're running and training for the marathon, that you drink per your thirst with care not to over or under drink. And then I would say just have fun. You've been training for a long time, you've been preparing yourself. It's going to be a big day, it's going to be an exciting day. Hopefully your friends and family are going to be there, and I would just say have fun and enjoy the moment. And then you're going to have plenty of people there that are going to be doing it with you, and then a lot of medical professionals that are going to be around to help and assist if needed, but hopefully not, but they're as needed.